Hey, you two.
Hey, are
That
we
was
live?
quite the, we're live. That was quite the countdown, huh? I was kind of thinking we were taking off in a rocket ship or something. There's enough nervous energy going on to join on LinkedIn Live. How are you two doing?
So happy to be here. Thanks for inviting us today, Brian.
Yeah, I'm glad you guys joined. I want to welcome everyone to the Insight in Google Chrome Enterprise LinkedIn Live session. We're going to be discussing cloud technology in healthcare. My name is Brian Cia, and I have the pleasure of moderating our session today. I'll spare you my title as it takes up about 2 full business cards, but I currently lead a team of business development and strategy managers focused on driving insight solution area messaging, along with responsibilities for driving our healthcare and GPO relationships. I just recently celebrated my 6 years here at Insight this week, as a matter of fact, but I have over 20 years of healthcare experience in and around the channel. Thank you very much. I'm joined by two amazing individuals today. Let me first introduce you to Angela Gause. Angela joined Google in 2017 and currently serves as a Chrome Enterprise Customer Success Manager out of the Chicago area. With 15 plus years of experience in the IT industry, she has been highlighted for her work with organizations to adopt and optimize their endpoint computing strategy, especially towards healthcare. Today, she's driven to ensure her customers realize the full potential of their investment in Chrome OS by streamlining app delivery and deployment, reducing workflow complexities, and improving both the clinical end user and patient experience. Hello, Angela.
Hello.
So
Thanks
it's
again
great.
for having me.
No, it's great to see you. Thank you so much. I've had the pleasure of knowing you for over 4 years now, I think. I think there'll be some people on this that would still question us being in the same room, at least virtually, right? Considering at one point in time in our careers, we were on opposite sides of the fence. But
It is
um,
true, yes, but it's great to be here today, and it is funny. And I hope that some of our friends are joining us from the days old.
absolutely, they know who they are. So I'm lucky to call you a colleague. I cannot wait to chat with you today. I always walk away from our conversations smarter than the last time we talked. I don't know that you get that same benefit, but I
Absolutely,
certainly do.
likewise, Brian.
Speaking of smart, let me introduce Harjo Sidhu, Senior Architect for Insight's Connected Workforce Solution area. Harjo started his career with over a decade at BlackBerry in various engineering, product management, and sales roles. He then joined a small managed mobility services organization where he led a consulting division. Finally, he joined Insight in early 2019 with a focus on managed endpoint services, including services around Android and Chrome OS devices. How you doing, Harjo?
Doing well. Good morning, good afternoon.
Yes, good morning and afternoon. This is technically really the first time we have worked directly together, but your reputation precedes you for sure. We do share some commonality, not only in our focus of healthcare and IT, as I learned this week. We both have Canadian blood coursing through each of us. However, you're much tougher than I am. I'm a wimp and probably can't handle anything below 70-degree weather. So being an Arizona boy, but I'm looking forward to getting to know you more, and I've enjoyed getting to know you and following up with your perspective today. So
I
thank you
hear
again for joining both of you.
you. It's our pleasure.
Let's jump right in.
Good.
Obviously, it is a challenging time for our healthcare system right now. If you were to Google the top challenges healthcare IT executives are facing, you would see that reducing costs, mobility, securing data, digital transformation, along with moving to the cloud, are some of their biggest concerns. And to top it off, now you have a pandemic that is overwhelming the system and continues to ask caregivers to shift their focus and spend. So, Angela, Harjo, I'm sure, like me and likely our audience, you have some fatigue around this little thing called COVID. But let's talk about the pandemic and how it's impacting the US healthcare system today. How is Google Chrome Enterprise making a difference in healthcare today?
Yeah, thanks so much, Brian. I think that's a great question. And to start off, and sort of, this morning I was listening to the news and I was hearing the case numbers. So I wanted just to start off today by sincerely thanking all of the healthcare workers out there on the front lines every day for all of these months, and anyone who is working in the healthcare industry. This is such an unprecedented time. So just really wanted to start by saying thank you. And I know that it's more of a serious topic. I hope that we are able to have some fun today in the conversation, but just wanted to start out by saying that.
Great.
With that said, on how has Chrome helped? We're serving in a few different areas today across the continuum of care. So whether it is in an ambulatory, senior care, or acute care setting, there's a few ways that we're helping. Right now, one of the best ways that we're able to help from alleviate some of that physician burnout perspective and just some of the features that are native to the Chrome device is in reducing that physician or end user burnout by allowing for faster boot times and things like that. So just physically interacting with the device is great and provides a seamless platform to get to electronic health records or any software application that really an end user needs to get to. So that's sort of number one. Number two is that patient check-in or checkout experience. So whether you are arriving and you need to give your critical details to get to your appointment, sort of streamlining that experience, Chrome is serving in that capacity. And also in the areas of providing web browsing, oftentimes, again, either in those waiting areas or in like in an extended stay situation for families in either a library or a room type setting. So those are some of the ways that Chrome has been helping, but specifically as it pertains to COVID, what we've seen, it's just been so remarkable really to see all the ways that our customers have been leveraging Chrome. One such use case is at the bedside. And back, I think it was in April, an ABC outlet in North Carolina covered Advent Health. Chrome was used at the bedside for patients to stay connected with their loved ones who are not actually able to meet them in person because of the restrictions from the virus. So that would be one way, either in that patient-facing and or telemedicine use case. And then also, and that is a true way that we've been able to help. And then secondly, from a work from home remote worker response, I had several customers actually who basically went into a weekend and they came out the other side and just like so many of us, right, they had to support potentially hundreds, if not thousands of people remotely. And so we saw that some people who actually were not even Chrome customers yet leverage the Chrome OS solution because they were able to quickly and seamlessly enroll those devices and get them into the hands of their workers so that they could be remote. So those are two specific examples.
Those are great examples. Great examples. Thank you for sharing. Harjo?
Yeah, that's terrific, Angela. And frankly, I mean, Angela's you're going to have more recent and more tangible use cases as it relates to Chrome devices. My current role has me a couple of steps removed from the ground level use cases, but I have a lot of historical experience, and probably the most fulfilling experience in my career was with healthcare. It was with the deployment of mobile technology, in my case, mobile technology, so Android smartphones in particular, into the hands of community health workers. And so it isn't the most recent, but the use case is definitely still prevalent. And it was astonishing to see the current state of that field force. So my past and history when it comes to technology is always focused around the knowledge worker and the executives that need email, and the criticality of it isn't as great as it is in the case of some of these healthcare workers, where if the system goes down, if they lose their device, if it's broken, if they're stuck in an update cycle for the equipment, their productivity collapses, and it has a tangible impact on clinical care, on patient outcomes. And it was astonishing to me, right? Because I did a lot of consulting at the time on their current state when they were using legacy technology. And it was very fulfilling to see the difference, in this case, that Android smartphone and this home healthcare application, home scheduling and safety application made in their lives, including a lot of safety elements that were built in for this team. And that use case still applies whether it comes to Chrome. I mean, more specifically because a huge part of the Android app ecosystem has been brought over to Chrome. And so those same types of application motions will be available in this one. And providing your field force, providing your end users with choice around form factor, whether it's a smartphone, whether it's a tablet, whether it's a Chromebook, and other Chrome OS devices, is more and more critical today to ensure that the workers have the right tool for the right job. And so I do have, more of that historical experience, but the needs and the criticality of technology for healthcare is just as great and far greater than it ever has been before. And the trouble is, of course, and we have a question around related to this, I think, and I'm not sure when we're going to get to these questions.
Go ahead, jump in.
Please feel free to submit these. But what's the biggest challenge U.S. healthcare is facing currently? I'd say it's the overwhelming roadmap that they're facing as it relates to this. The change that could be happening. How do they get back on the front foot? How do they start tackling all of the transformation available to them, right, in a strategic fashion? It's not a lack of technology and a lack of transformation. It is an inability to tackle it effectively, because they're so busy day to day fighting the tactical issues and the firefighting that's involved, not just in technology, but obviously when it comes to something like the pandemic, where resources have to be shifted away. And so our focus at Insight has really been along that realm to try to help organizations get back on the front foot. So, and again, that community healthcare, was probably the best experience I've had in my career in terms of how technology has transformed the workforce. So it's exciting to see how Chrome is doing, following the same path and doing something similar.
Yeah, absolutely. I think I would just add to that, particularly is, addressing or managing the burnout, because and I just actually was listening to a podcast in the car the other day, and it was the TEDx Secret series or something like that. It was like, I have a secret, and they were anonymous talks. And this physician was speaking about how for 4 years she's been carrying in her heart an interaction that she had with a patient. And, when you listen to the whole talk, what ended up happening was that the patient was frustrated and they wanted to leave. They were upset. They were just, their care or the stay, they were just frustrated. It happens. And so rather than digging deep and, meeting that patient where they were and saying, let's talk through this, she just said, "Are you sure?" And then they left, and then they came back, and 2 days later they had complications and they passed away. And so that's where, hearing that story of burnout was really meaningful to me, because when, it's in the day to day, it's in how long, and there's many factors associated with burnout. I'm not going to say like a Chromebook can solve all of it, but when it comes to the time it takes to get to applications, the time that it takes to interact with your device, if that becomes more seamless, then that can at least be one part of addressing the situation. Hopefully.
Excellent. That's an excellent point. And, when the question came up about the biggest challenge U.S. healthcare is facing currently, we could break out a laundry list of a million different things. But I agree with you that I think what's forgotten is the continuum of care, right? I mean, at the end of the day, our health system is here to help patients get better, right? And the challenge that you have, and Arjun, you made a good analogy. I have a VP of sales here that always talks about getting off your heels and onto the balls of your foot, right? If you're back and on your heels, you're reacting, and sometimes that's not putting you in an opportunity to be more successful. So addressing that and being forward thinking and addressing that is very, very important. So thank you to whoever submitted the question. It is an excellent question. Not always the easiest to answer, because you could rattle off a whole ton of issues that our healthcare system is facing today. But I think what we're all saying is that the focus has to be back on care. And if you can be more efficient, you can leverage technology to be able to ensure that those patients are being cared for, you're going to be more successful.
And ultimately contribute to those outcomes.
I just want to say, I am super jealous you get to listen to TED Talks in the car, because I'm still stuck on Broken soundtrack, nonstop looping. One day I'll get back to those podcasts. Okay.
Thanks for sharing that, Harjo.
I don't want to go without acknowledging and echoing your sentiments, Angela, about what healthcare workers are facing on the front lines. You just talked about the burnout, but there's many, many examples. I have, several healthcare workers, nurses in my family, and the stories that they tell just would break anyone's heart. It's hard times. I mean, it's not and faced with an unprecedented time within our health system. So I want to say thank you as well, and I appreciate you bringing that up. It's obvious in the conversation already. What are we in? 16 minutes already into this conversation. The incredible amount of experience you guys have around, excuse me, around this. Moving applications to the cloud, obviously it can be concerning for any IT leader, maybe especially within our particular audience today. Frankly, it's a daunting task. What do you say to these leaders that are faced with these questions, who may still be sitting on the sidelines about moving themselves to the cloud?
Is that for myself, Brian?
How about Harjo? We'll start with you.
Sure.
Again, we went Angela first, and ladies first, of course.
Yeah, no, I'm happy to kick things off with that one. But bad news. It's happening whether you like it or not, right? So consumers, this whole back foot, front foot, tactical versus strategic, firefighting versus having your handle on your roadmap and a plan for the next 2-3 years is being driven by consumer adoption of the latest technology and the capabilities that are out there. And consumers aren't going to wait for you. And the fundamental problem is that your patients, your clinicians, your end users, your employees are all consumers.
Right.
And so they are experiencing the epitome of the experience bar when it comes to applications, right? And that bar is rising at all times. So, do you have an installed application instead of a website, a cloud-based experience? That is becoming rapidly obsolete. Are you forcing your end users to use VPN? That is becoming rapidly obsolete. Do you not have a seamless experience on mobile? Right. That is rapidly obsolete. Not having multi-factor authentication, or trying to do two-factor, multi-factor authentication with physical tokens instead of your mobile authenticator or biometrics, rapidly obsolete. Even the concept of using a password. I wouldn't say it's rapidly becoming obsolete, but it is becoming obsolete. Maybe not rapidly, but someday the concept of a password is going to go away.
Well, with the way that you have one for every single site and it's 32-character alphanumeric, it's just
right. And yet we're all still clinging to it, right?
Oh, exactly, right. Yeah. But I mean, there's a lot of movement happening. It's happening whether you like it or not, and so this is independent of the platform. Right? Whether you use the Google or Android or other platforms, this is not specific to the platform. It is a movement in terms of the application experience. But the benefit of Chrome was that it was designed to accommodate the future in terms of this SaaS-based, this cloud-based, and cloud-centric world, with a particular focus on something called progressive web apps that Google in particular has emphasized. We won't go into the details of it, but let's just say a really well-designed cloud-centric application should easily meet and exceed the experience and functionality that users have today with applications on their machines. And I won't even touch on the dramatic difference that this transformation has on management of applications. Imagine the world, if you will, not having to package, not having to wrap, not having to script and deploy and deal with the updates around applications. I mean, it's completely transformative. And so, this movement is just, it's rapidly happening, and organizations risk being left, behind, and their end users and patients and everyone going around the organizations and the application suite that's already been put in place. Right. So that was a very long-winded way of saying it's happening.
No, but and you jumped into other topics, and probably that's for another day, because I think they only gave us really a half hour to chat today. But you're 100% correct. Angela, anything you want to add to that?
Yeah, I actually would like to just echo a couple of things that I heard. I'm taking notes on the side here. Harjo, I heard you say the word consumers, and that is actually how I oftentimes explain it. Here at Google, we have several applications that are used by over 1 billion users every single month. And those are applications that are for entertainment. Maybe it is music or, movie based. Maybe it is wayfinding and maps based, or getting access to your own data points. But regardless, if you're looking at it from the caregiver side, and it's the end users that you're managing, or if you're looking at it from the patient side, so the care that someone's receiving, in both scenarios, both of those individuals are still people and they're still consumers. And this experience, that we have come to, the way that we interact with data and applications in our everyday lives is an always on instant access connection experience. And so now that we know that that's possible as consumers, we want that in our work life too. And so I think it's almost, coming at it from the perspective of like customer service. And if you can give your end users, your caregivers, and your patients what they want, then, both groups of people will be more happy. And I know, Brian, I want you keep us on time here, but also Harjo, I heard you say something else. And this morning,
well, to echo that, I think you're 100% right about want, but it's also getting to a point where it's expect, right? We've gotten away. I think we all have gotten so used to it that it's not just a want anymore. We can ask, but we're also expecting it. And when we're not getting it, that patient care, right, is impacted significantly. So if you're not keeping up to that, and I didn't mean to interrupt you, but I will. I promise I'll keep us on time with my.
The point, right? I mean, I would agree with you actually. And the other point I was going to make is in the perspective of agility. So I was preparing for our talk today because I wanted to make sure I was up on the latest, Brian and Harjo, for our viewers today. And Becker's Hospital Review released today an interview with the CIO of Fairview Hospital, next door from me in Minnesota. And what the CIO there said was that, in his career, that planning used to be done on a 5-year basis. And you just said it, Harjo, that we've been talking about plans in terms of like 2 to 3 years. And then this year with COVID, that really turned a lot of things on its head. So now it's more of like a 6-month to maybe an 18-month planning cycle. And where Chrome fits into that is in agility and scale. So as the timelines for planning are shortening, Chrome can allow for people to make plans on a dime.
Yeah, I agree. And, it goes back to, I think, what Harjo initially had said, right, is, whether you like it or not, this is happening. If you're not on the train, you got to get on the train. We know this. I mean, due to what the market is dictating, we know Chrome Enterprise itself is becoming more widely accepted in healthcare. I have customers reaching out to me on all the time to learn more about the advantages of Chrome OS overall, and still wondering if it can work in their hospital, in their environments. As a partner, Harjo, how does Insight, along with Chrome OS, address those questions of how to enable Chrome within the enterprise? And there was a similar question that was in the chat box that maybe that you can help address, but I don't want to your point about time, and don't want to get too sideways in our conversation, but can you answer again, or at least address those questions about how to enable that within the environment?
Yeah, absolutely. It's it depends on the state of knowledge for an organization, right? So sometimes we have to start right back at the basics on dispelling and busting some common myths around the Chrome platform. Fundamentally one of them, and quickly just rhyming off a few. So Chrome is completely independent of G Suite, right? So there is some perception out there that, Chrome requires G Suite or vice versa. And that's not the case. I mean, the Chrome OS devices, Chrome Enterprise, is designed to incorporate into an existing endpoint program, right? So it can be just yet another endpoint that is put in place. Another myth is around the perception of the fact that Chrome devices are low powered, and this might be driven a lot based on the education sector in particular. That is certainly no longer the case. Chrome has a massive number of device options, including some that are extremely powerful and some that are incredible form factors, including I've seen ones with the the flip screen design. So really designed all the way up to the executive level in terms of its capabilities. The application story, I talked a bit about that around the Android story. So, this concern around whether applications are available on the Chrome platform, addressed very effectively from Google, not just in terms of the cloud-centric and SaaS focus, which is a big part of it, but also, as I said, the Android applications, VDI approaches. I think there's Linux components that are available. So, a major focus from Google, and that's been heavily addressed. Finally, there's training concerns. Yet another ecosystem. How much training do I have to do? And is my support organization ready, and that sort of stuff. And I heard one. I forgot who coined this. Probably someone from Google, but they said if your end users know how to use a Chrome browser, they know how to use a Chromebook. And that it oversimplifies somewhat. So we do have some training, but it's largely accurate, right? I mean, people should be able to get off the ground and off they go.
I think beyond for my friend Dan, we can shout out to Dan K. I'm sure
it was probably Dan. Yeah,
yeah, it probably was Dan.
Yeah, I'd hear you. So, but beyond those basic myths, there's a number of, we've put in tremendous effort within Insight to become Chrome experts, to build our certifications, our expertise, build our environments, and build a set methodology in terms of how we can support our customers with multiple modules that can be selected based on what they need. If it's around acquiring equipment, obviously they can purchase Chromebooks and Chrome OS devices from us. So the acquisition option is in place. The financing option is in place. We've had white glove services in terms of configuring the devices for over 5 years, right? So we could configure the devices, make sure that the end user experience is more optimal. But we're also very excited. A very recent announcement is around Google Zero Touch. So Zero Touch enablement. I'm excited to emphasize that Insight is the first and currently only authorized pre-provisioning partner for the Zero Touch enrollment experience on Chromebooks. And this is essential. I can't emphasize this enough. It allows for more rapid deployment. It allows for lower cost deployment because in many cases you could skip the white glove component. And most critically, the end user experience is seamless. So this matches the Android Zero Touch experience. When the user gets it, it's already linked to your organization and those profiles and those security settings. So we're really, really excited about that unique Insight capability. Beyond that, we have a robust Chrome program readiness review, kind of like a traffic light assessment, not just of technical elements, but going beyond that in terms of an organization's state of readiness around procurement and support and their identity, and as I mentioned, applications as well. We have a module around the configuration of the Google Admin Console, so all the security profiles and settings and the whitelist, blacklist configuration. We also have a component around operations guide. So if you want to continue to manage the Chrome program internally, then we can develop an operations guide to ensure that your procurement and disposition, so forward and reverse logistics, is well established. Your support organization is ready. So this builds basically your internal run book for your support and management of the program. But we also have our ongoing management services around it. So we have support services available and device lifecycle services. So again, ongoing asset management and management of the devices outbound and returns, right? So if an employee leaves, we can manage the return process, put it into a spare pool, make sure it's ready to redeploy. So there's a lot of that capability that's built in from Insight. So a lot of work has gone into preparing and ensuring that this acts like any other endpoint within your organization, or it can exist as a standalone bubble within the organization, right? And so that's an important point to emphasize. IT could give the blessing on a Chrome program, but have it exist standalone. And that enables rapid deployment, rapid management and getting it up and running without a significant burden within the organization. So that was a long ramble. I apologize for that. Go ahead, guys.
I was taking notes so I can address all of that, right?
Now, sometimes I get on a roll, right? And then you got to just basically
great.
say, okay, that's enough.
No, it was great.
All right, guys, go for it.
Yeah, so sort of, I did see a question that popped up on our live program, and I believe it was around enabling patient pathways. So I did want to just quickly address that, and then we'll unpack some of the things that you just said, Harjo.
Sure.
But my response to that would be, how we're able to serve is in the multiple form factors that are available in the portfolio. So from the notebook form factor, what we call a Chromebook, or a traditional desktop, we call a Chromebox. We also have an all-in-one, which we call a Chromebase, and we do have a tablet offering. So because we have that ecosystem of hardware flexibility, you're able to enable your patients, whether it is an example, again, of check-in and check-out, and you're streamlining that process and making it more convenient to actually visit the doctor, or if you're putting it in a particular place to increase patient comfort or get access to information. That was the question. Yeah. So hopefully if you have a follow-up on that, I would say that would be my guidance. But going back to Harjo, what you said.
Can I follow up on that response though? I mean,
yeah.
Sorry.
Yeah.
So the patient pathways, I mean, and I'm speaking to the audience here, you're going to know better than I do in terms of what you need at the ground level for your patients, right? My objective and Insight's objective is not to be prescriptive on the workflows that you've put in place within your healthcare organization, but to equip you with the tools, right? In terms of the right technology, the right tool for the right job, but also to offload the tactical burden within your organization. You're not going to transform your patient pathways and the workflows that are in place to make a meaningful difference if you're spending all your time debugging calendar sync issues or handling upgrade issues, or there's a security threat. Those day-to-day activities are completely crushing your ability to move your organization forward, right? And that is a heavy focus in terms of especially the connected workforce division within Insight, right? Which again is to assist you in terms of the service load within the organization. So I mean, again, Angela's closer to the ground in terms of healthcare, but that's usually my gut reaction when there's such a detailed question about a vertical such as healthcare and that type of workflow.
And that's just such a great place of response from the Insight team in particular, because of the other things that you were talking about. How do we enable the environment? First you came out with the myth busting. I love that I love that show on TV. Those guys are so funny. So thanks for doing that, Harjo. And then you also talked about the cloud readiness assessment, which is where we always recommend our customers start in identifying their use case. How do you get to the use case? It's knowing what applications your end users are using. So you covered that. And so generally speaking, just talk to Insight. They'll be able to hold your hand and guide you through it. But then specifically also, I just want to touch on, this is a really important news beat for us in case you missed it. HIMSS was canceled this year. It was, it pivoted from the original format, and we had planned on kind of, making a big announcement about our integration with Imprivata, Batch Tap and Go. That did go live in April. So it was a multi-year journey. Yeah, it was a multi-year journey for us. So we're really excited to bring that to the marketplace. And that functionality in particular is a big one that enables for those workflows to occur. So just wanted to make sure that people knew about that.
No, that's great. I mean, at the end of the day, what we're talking about is that you don't have to do this on your own, right? There's people out here to help you with the information that's out there. We're not going to assume. We're going to learn about your environment, learn about your needs. We're going to partner with the right, I guess partner with the right partners. I guess they went down the wrong stretch there, but to make sure that your needs are met. It's a challenge that again was holding most folks up and making decision to move forward. I also love the Mythbusters reference. I don't think Insight will let us blow some things up and test some theories around here on a stream, but might get us in trouble. But again, great information is essentially about how the readiness assessment can really help. There's a lot of things that we can talk about to keep us on time. We could go in all day and talk about security, right? How a security need is necessary. A lot of recent ransomware attacks, they always continue to suggest that patient protected data is always, will always be under attack. I'm gonna move on if you guys are okay with that, just simply because we probably could take a whole day talking just solely on security. But I think
I would only plug Brian there in case anyone
Sure.
have questions about the Chrome security story.
Please.
There's a lot of details on our website, Chrome Enterprise. Just Google Chrome Enterprise Security, and you can get all of the information about the multi-layers that the solution brings.
Great.
Yeah, I mean, the Chrome put a lot of effort, obviously, into the technology as it relates to security, but there's so much more as it relates to, the application security. I know it's simplistic, and there's a comment around concerns about moving applications to the cloud. It's easier said than done. There's no question about it, right? So, but there's tremendous resources at play within Insight, not just within Connected Workforce, but also digital innovation around application remediation and that strategy to shift to the cloud, whether it's VDI, whether it's again, a coding that might have to take place, but lots of different approaches. But also I want to emphasize security in your processes, right? And so, your lost stolen scenario, right? If someone loses a device in the middle of Friday, in the middle of the night on Friday, are you able to respond quickly enough? Can you secure the data quickly enough? And then if someone loses their device, how long does it take to get a new one?
Yeah.
Right. And it's hard to be transformative if it takes 2 to 3 weeks to replace a piece of equipment, as opposed to our service level, which is the next day. Right. Same day shipping in most cases. So so there's a lot of factors. It's a loaded topic around security. I guess the most important thing to make note of, as Angela already said, is that it's intrinsic and fundamental to the design of the Chrome OS platform.
No, that's it. Yeah, sorry.
I know you tried to skip that question, but since
no, it's okay.
I just want to read what you'll find on that site is information about how the OS is read-only. It provides verified boot, leverages sandboxing, and the software and hardware work together through a Titan C chip that is built into every single Chrome OS hardware device. So now I said my piece. I wanted to just make sure that people knew the highlight reel on that.
Absolutely not. And that was not the intent. We obviously are getting some great questions that are coming through on the chat. Unfortunately, we have, cannot address all of them. But what I'll say to folks who are sending in questions, I would love for you guys to reach out to any one of the three of us. Obviously, you can do via LinkedIn. Feel free to ask any questions that you have. We'll be happy to work together to, try to answer every question that you possibly do. As you can hear from these experts, and I easily can say experts, is there's a lot that goes into your needs, your assessment. We saw some folks that are, putting in the chat box about, that's not really my issue, and that's great. That means you have taken a step to understanding what your roadmap and your readiness is to that, and that's wonderful. Not everybody is there, and we recognize that, and we're in a shifting environment as well. So you need to be readily prepared, and using partners is going to be the best way to get you there. So one of those. So with that in mind, I said, guys, all this information sounds like it's a really a heavy lift. There's not. As I mentioned before, I think some of folks out there are probably shaking their heads and saying, "Man, I really have no idea where to start." Right? But is it really the case? I mean, I've heard you guys talk. Is it really that hard? Maybe Harjo, you can. What should IT leaders or business owners really be, addressing or prepared to address?
It's not a heavy lift, but due diligence is required. Right, and there's a key difference there, right? So you got to tick all the boxes. That's been Insight's approach. Either this traffic light assessment around the readiness review within the organization, and then individual modules that can address your specific needs. Do you need to deploy devices more quickly? Do you need to configure your environment to ensure you meet your security requirements and data residency requirements, for example? Or do you need to ensure that you have a successful support program in place? So these little pieces just need to be checked off. But as I mentioned before, we have examples of customers that have deployed thousands of Chrome OS devices independent. So with IT's blessing, and I mentioned this, with IT's blessing, so I'm not advocating for any kind of rogue behavior here, but exist entirely separate of IT infrastructure, right? Because of the cloud-centric nature of the solution, that particular line of business, in this case, it was a series of retail stores, were able to deploy far more quick, far more flexibly, because they were able to put not just the technology bubble over to the side, but the entire support structure and management structure with Insight's help over to the side as well, right? So that's one of the beautiful things about the way this ecosystem operates.
Excellent.
And I
Excellent.
guess the only thing to that I would add is it's not a heavy lift when you have a great partner like Insight to lean on and kind of, do some of that research and deployment services for you. So that would probably be my number one response to that. But secondly, also just in working with specific customers, we do have instances of customers that in some cases there's a single person or a small team, 1 to 3 or in some cases more, that are managing thousands of Chromebook devices. So once the initial configuration has been established, I probably shouldn't say set it and forget it, right? Like it's not really what we want to encourage, but it is a very, sort of make the solution work up front. And then it's a more of a monitoring through the central management console as it goes. Just to take off some of that from the heavy lift perspective, Brian.
Yeah, no, thank you. That's excellent. That's really good information. I did just notice in the chat that for those interested, in the comments section, there is a healthcare specific case study about Chrome enhancing security. Please take a look at that, download it at your, at your convenience, but great information as a follow-up to the question that we had around security. So, we're coming pretty close to our time limit. We're already over it, to be honest with you. I think I'm going to be, maybe shot on sight for being not a very good time moderator throughout all this. Hopefully, I survive this. I think if you guys are okay, Harsh, I'll ask, you kind of, one last question. We kind of talked about those next steps, right? Any closing or additional closing thoughts to that? Because I can easily throw it to Angela as well in her closing thoughts.
Yeah, I'll try to be quick. I mean, I always say that, but I never am. But anyway, so I mean, the main thing is ask yourself, you really want to do this by yourself? Probably not, right? I can answer that question. No, don't do it by yourself. And then honestly, I would suggest in terms of next steps that might be available, that Chrome OS program readiness review. Actually, Angela's going to talk about something really exciting from Google around that and around a tool. I don't want to steal her thunder, but it's actually being embedded into the broader readiness review that we would put in place. So again, it's actually available from Insight, and we have a promotion on right now until the end of this year where you can get that for free. You can get the full readiness review for free, which goes into, so it talks about, it goes and assesses your identity, your communication, your deployment and procurement methodologies, your end user support readiness, everything, right, for your current state and how well you're prepared for it. We also, by the way, have a demo program available to evaluate Chromebooks before you purchase them. So there's like 120 different models that are available from Insight that you can get. And to emphasize the point about the lack of a heavy lift, each of these Chromebooks within the demo program are already enrolled into a sandboxed management environment. So Google Admin Console environment, it's already under management. So you actually experience the level of management control and security in these demo devices that you would have in a real life enterprise or corporate deployment scenario. So I'll just close on those two main things from Insight that I would encourage folks to have a look at.
No, I appreciate that. I really do. Angela, anything
Love
you
it.
want to add as a close?
Yes, I think we probably said at least 15 times that about the cloud readiness assessment. So that is available to you. But also, actually, as of Tuesday this week, our team launched a Chrome on Air ordering and device provisioning options. So if you're interested more about specific next steps and kind of how the process works, I would encourage you to check that out. It's actually on my LinkedIn page. It's also on the Chrome on Air channel. And then also, as Harjo just mentioned, we're very excited to launch. And I think that our producer here threw this up on the screen.
There you
Perfect.
go.
Thank you. Chrome OS Demo Day is coming up on Thursday, December 3rd. And it's at 8:30 a.m. Pacific, 10:30 Central. We're going to be covering, it's actually only 1 hour. It says Chrome Demo Day, but it's just 1 hour. So it's not too much of a commitment of time. And we're going to be covering our new partnership with Parallels. So in the virtualization space, we're going to be covering that cloud readiness assessment that we've been talking about, the new zero touch enrollment feature that Harjo mentioned, and then also our Chrome Enterprise Recommended program, which is going to feature some of the partnerships and applications that are already kind of stamp of approved, ready to go on Chrome.
Excellent.
As well as some new cool productivity features like Chrome tabbing, which I also just recently posted on my LinkedIn. So lots of really great information coming up, a huge agenda in a short period of time. So those would be my closing thoughts. And then also just for our customers who have been with us along the way, when I joined the team in 2017, we had 250 security policies in the Google Admin Console. And this year we're going to be wrapping and launching another 100 policies. And that's really due to customer feedback. So as healthcare continues to scale and grow and transform, and we've moved from paper to digital record keeping, Chrome OS is also evolving and growing with you. So thank you. Keep that great feedback coming in. We'll continue to innovate so that we can keep your end users productive and your patients happy.
Excellent.
Well, Angela, with 400 policies, it's almost like you need management expertise outside the organization to handle it.
Stole my thunder, but that's that's exactly where I was going to go with that. It's great. Parallels is a great partner for us too. They're wonderful. I'm glad you guys have entertained that relationship. Thank you, really, for all the information. Like I said, you guys have been incredible here. As we kind of wrap up, I do want to echo some of the things that you guys threw out there, including Google Chrome Enterprise has this new exciting digital event. You can find the invite to attend, but Chrome OS Demo Day will be Thursday, December 3rd from 8:30 a.m. to 9:30 a.m. Pacific, 11:30 to 12:30 Eastern Time. Angela went into what the details of that, but you will see a demo and learn more about the Chrome OS Readiness tool and help find the right device for the job you do. They will learn how to deliver devices and apps quicker with zero-touch enrollment, and Chrome Enterprise recommend remote configuration, as well as how to stay on task from anywhere with end-to-end productivity using Parallels Desktop and improved productivity features. I think you stole my thunder there on that one.
Sorry.
That's okay. That's no problem. Now I'm reading from script, right? So also in the comments section, along with that healthcare case study from Google, we have a link to sign up for Insight's Chromebook demo program. By signing up, Insight provides access to over 120 plus devices from our partners like HP, Lenovo, Samsung, Google, and more. Select from a range of form factors, including clamshell, convertibles, all-in-ones, and tablets. And if that wasn't enough, each Chromebook demo, as Harjo pointed out, includes a Chrome Enterprise upgrade trial in a sandboxed environment, which provides access to the Google Admin Console. It's a great, great opportunity there to learn more about the device. And on insight.com, everyone, there are use case studies, a ton of information to help you on your journey, including, as Harjo mentioned earlier, the Chrome OS Readiness Review that is delivered by Insight's Connected Workforce Solution Area team. There's just a ton of information to assist. I go to Angela's LinkedIn site all the time to learn stuff. Please spend time with her and connect with her. Harjo, you've been amazing. I really appreciate it. Nobody's going to question your long-windedness, my friend. You got a ton of information in that brain of yours to basically get right out of your head. So I appreciate the time. Like I said,
I can also
probably
sing the entire
didn't.
Frozen soundtrack, by the way. So.
There you go. I probably didn't keep us on time well enough, but hopefully this was good information for everyone participating. Again, as I said before to our audience, if you have any questions, feel free to reach out to any one of us on LinkedIn. We're happy to answer any questions you may have or thoughts that you want to convey to us as part of this conversation. It's been a pleasure, you two. I appreciate both of you. I appreciate your time. I wish you safe, happy holidays, you and your family, as well as to our audience. Happy holidays. Thanksgiving's next week. It's a good
Thanks,
time.
Brian. Happy holidays, everyone. Thanks again.
Thanks, Brian.
Thank you, everybody. Take care.
Everybody. Take care.
Be well.